On the day of your treatment, you will be at the clinic for an hour to an hour and a half, but you'll be in the laser room for just around 10 minutes. When you come in, we'll get you to finish the necessary paperwork. Then you'll meet with the ophthalmologist who will be doing the treatment for you. The doctor will review your initial consultation you have already had done and double check all the important elements and measurements. Then you'll be told what to expect during the procedure step by step, and you can ask any last-minute questions you may have.
We then get you into our preoperative area where we put a hat on and we put some drops in, some freezing and some antibiotic. You then would lay there for about 5 to 10 minutes while we get the laser program for you. You then go into the operating room where we lay you down. We do the laser procedure on one or both eyes, depending on what needs to be done. With an intralaser procedure, we would make both flaps before we actually reshape the eye. So we actually start off in the operating room with you. We put a suction ring on the surface of the eye. We engage that. We then swing you under the laser that makes the flap. We dock the laser with that suction ring and make the flap. We then take all of that stuff off the surface of the eye. It is quite fuzzy after the flap is made. We cover that eye. We make the flap on the second eye. And then we swing you under the second laser, the excimer laser, to reshape your eye.
They will be looking up into the laser. They will see a small blinking orange light, which is their fixation light. I then explain to them that the laser will track their eye during treatment, and that we'll be putting a small retractor between their lids to keep them apart.
With PRK, to actually get to the stroma, the actual substance of the eye, we have to remove the skin surface. So we put a little ring on the surface of the eyes, and we put some alcohol in there. The alcohol sits there for 30 seconds, it loosens the skin surface, and then we can just wipe the epithelium off.
The laser is used to reshape the cornea. There is no pain involved during the procedure. The only unpleasant part is the possibility of you smelling something similar to burnt hair. But rest assured that nothing is burning. The excimer laser is a cold laser. At the conclusion of the laser treatment, the surgeon may choose to dab a small amount of another type of solution on the eye for several seconds to reduce or eliminate the potential of the eye overhealing. That would require more laser treatment in the future. A clear bandage contact lens is then placed on the eye, and the whole process is repeated for the other eye, assuming you are having both eyes done. The contact lens is left in place until your epithelium has regenerated, at which time we will take the lenses out for you.
We then get you back outside. In the postoperative area, you would get your postoperative instructions in terms of drops and activities. If you have PRK, then you're ready to go at that point. With intralaser, we like to check the appearance of those flaps that we make afterwards twice. So we see you once, the surgeon would see you once right away, and then in about 20 to 30 minutes after your procedure to make sure it looks good, and then you would be ready to go. The bigger the prescription error, the more of a wow factor there is right away. So if you're about a 1 diopter myope, things aren't that blurry without your glasses. It's always not perfect right after the surgery, and so you may not notice. The 5 or 6 diopter corrections that we do, or the big astigmatism corrections, they get up off the table, and the ones that are funny are the ones that cry. And you go, "Are you okay?" And they're, "I can see." And so there is definitely a wow factor, but the wow factor is really comparing what you could see before without glasses to what you could see afterwards. We don't expect any of our patients to have perfect vision walking out of the building. It's going to be a bit murky, and it will get better over a few days to a week.
If somebody had told me before the surgery that the most pain I would feel would be basically shut your eye and just apply a soft pressure to your eye until you feel a tiny little bit of resistance, that was it.
The doctor informed me every step of the way what he was doing and what he was putting in my eyes, so I wasn't caught off guard in any way. So that was comforting. It was a really short procedure. After that, I was able to lay down for a couple minutes, let my eyes rest. They put some more drops in, and then the nurse came over and talked to me about my follow-up procedure and what kinds of drops I'd have to use.
The service, the follow-up service, and the procedure itself here at London Eye Center was easy enough, even though I'm a big, strong football player. The thought of this terrified me, and the whole process was so seamless, so comfortable. I can't recommend it high enough.